So today I want to talk about some BPD vocab, borderline personality disorder vocab. As I see people asking questions on different support groups, I'll go ahead and define some words that you might see when you're learning about your disorder. And today I want to talk about splitting and dissociation. Let's start with splitting. So if you've heard the term splitting before or black or white thinking, you should know that they're the same thing. And in psychology, it's known as dichotomous thinking or polarized thinking. Dichotomous thinking is black or white thinking. So it's seeing things, situations, experiences, and relationships as either perfect or complete failures, all good or all bad. And since people with this way of thinking don't often see gray areas, you can end up feeling very disappointed or very frustrated. So that's basically what splitting or black and white thinking is, as a definition. Some symptoms that are related to splitting in BPD would include symptom number 2, a pattern of unstable and intense relationships, characterized by alternating between extremes in idealization and devaluation. So that means thinking of someone else as all good or all bad at any given moment. You can also split with yourself or have black or white thinking with yourself. But symptom number 2 is going to be the biggest symptom, I think, that's related to splitting. And let's see how that looks in real life. So in real life, you might be in a relationship extremely affectionate and doting one moment and pulling away the next. You will have chaotic, intense, or conflict-filled relationships maybe, going from extreme devotion to extreme anger very quickly. A pattern of many short-lived romantic relationships is oftentimes the case in people with BPD. Relationships may include things like accusations, anger, jealousy, bullying, control, and breakups. You may have in your other areas of your life an unstable work history or frequently quitting jobs, which is another side effect of this dichotomous thinking. If something's going all bad, you just give up on it. And you might exhibit needy or clingy behavior or anger and fury, both very disappropriate or disproportionate to the event that's happening. That's some ways that splitting might look in real life in terms of relationships and maybe with your patterns with your job. Other symptoms that are related to splitting would include symptom number 6, an affective instability due to a marked reactivity of mood. So that has to do with your mood changing kind of quickly and reacting to certain events inappropriately. Symptom number 8, inappropriate intense anger or difficulty in controlling anger. Oftentimes, when this happens, something, if you have an inappropriate reaction to something when your things seem to be going well, that might seem like or look like splitting to you. Another symptom that would relate to splitting would be symptom number 3, identity disturbances. So having a markedly and persistently unstable self-image or sense of self. And so that sort of that lack of sense of self or that negative self-image is going to cause you to have dichotomous thinking about yourself. So if you fail at something or if you perceive that you've failed at something, that this lack of self-identity is going to exacerbate the splitting feelings. Um, let's talk about some of the things that are going on when you're splitting. There are things called cognitive distortions, which are just ways in which our thinking might not be completely clear or completely in tune with what reality is. So here's 3 different cognitive distortions. The first one is called discounting the positives. So when you have something good going on, but you have the tendency due to depression or other symptoms that are going on to transform those good, neutral, or even positive experiences into negative ones. So if you can catch yourself not paying attention to what's happening with the good and only focusing on the bad or even transforming good into bad, you can recognize these cognitive distortions that are going to contribute to dichotomous thinking or splitting or black and white thinking. A second cognitive distortion is called negative filtering, and that's where you pick out a negative detail in any situation and dwell on that negative detail excessively. And without noticing the positive details and just focusing on that negative part, you're going to perceive the whole situation as negative. So if we can just take a step back and maybe take a look at what is good and what's going on, we can sort of see that gray area a little bit better. The third cognitive distortion is labeling. So creating, and that's when that has to do with that self-image. So creating a complex negative self-image based on your errors. So if you're focusing on your errors and you already have this symptom of BPD with your negative self-image or lack of self-image, labeling yourself as a failure or someone who's not good enough is going to contribute to this type of black and white thinking. So these are the cognitive distortions that you'll look at when you're going through therapy to try and help you with this dichotomous thinking or black and white thinking or splitting. The second term I want to talk about today is dissociation. Dissociation can feel like having an out-of-body experience or like you're a different person sometimes. I've heard people explain it where they'll be touching their own arm, but it just doesn't feel like it's them touching their arm. Um, you might feel your heart pounding, excuse me, or be lightheaded, feeling emotionally numb or detached, or feeling little or no physical pain. But dissociation is basically a breakdown or a break in how your mind handles information. You can feel disconnected from your thoughts, feelings, memories, and surroundings. Disassociation can affect your sense of identity and your perception of time. Dissociation, and how does it feel in real life? So you might feel like you have an altered sense of time. You might find yourself not remembering how you got somewhere, having tunnel vision where there's a lot going on around you, but you sort of feel honed in on one feeling or one thing, or maybe just a spot on the wall, but or having tunnel vision about a topic or something that's going on in your life too, focusing on that. Hearing voices in your head, having intense flashbacks that feel real. These are all ways that dissociation can feel in real life. Sometimes you can become immobile. You can feel stuck physically and you aren't able to move. And then the last one is getting absorbed in a fantasy world that seems real. Now, if you've experienced any of these things, you've probably experienced dissociation. Most people with BPD have experienced dissociation. Some of the warning signs that you might see looking into yourself and worrying about dissociation to see if you're experiencing that, look for things like rapid mood swings, trouble remembering personal details, being forgetful about things you've said or done. And I know sometimes this can be difficult because it's hard to believe sometimes when someone tells you you've done something and you don't know that you've done it. Um, Behaviors or abilities that have changed. So feeling like your identity is altered, like you don't feel like you anymore, or like if your tastes have changed or your interests have changed drastically and you're having an identity change. So that might be a symptom of you dissociating as well. Depression, anxiety, or panic attacks can be combined with dissociation. Thoughts of suicide or self-harm. Substance abuse can help to cause dissociation. You can also turn to it during dissociation sometimes. And then it mentions here that failed treatments or hospitalizations for mood disorders can also contribute to dissociation. But we know that we're talking about dissociation now because we're discussing it in terms of mood disorder, borderline personality disorder, which dissociation is a symptom of. Here are some symptoms related to dissociation. The biggest one is symptom number 9. It's right there in it. Transient stress-related paranoid ideation or severe dissociative symptoms. So dissociation is one of the 9 symptoms of borderline personality disorder. But some symptoms that are also related to dissociation besides that one include your identity disturbances. Symptom number 5, recurrent suicidal behavior, gestures or threats, or self-mutilating behavior. This can be a side effect of dissociation because it can often leave you feeling with chronic feelings of emptiness. So when you feel depressed or empty or separated or isolated or alone due to dissociation, you might end up having some of the symptom number 5. Treatments for dissociation include things like cognitive behavior therapy, hypnotherapy, which I don't know much about, something called phasic trauma treatment, dialectical behavior therapy, and eye movement desensitization and reprocessing. Cognitive behavioral therapy is going to help you. It's a psychotherapy, a talk therapy, which is meant to help you see and change negative thoughts and behaviors. I don't know much about hypnotherapy, but if you're interested in that, you can speak with your doctor. Phasic trauma treatment is meant to help you stop suicidal thoughts or self-destructive behavior first, and then it's followed with psychotherapy where you talk through the experience and everything second. Dialectical behavior therapy, which is the major treatment for borderline personality disorder, is meant to help you learn skills to control your emotions and stop harmful behavior. And then eye movement desensitization and reprocessing may help stop nightmares, flashbacks, or other PTSD symptoms. These are just some treatments for dissociation that you could look into if you're experiencing that. I want to talk just a little bit about DBT and how it can help with dissociation and splitting. There are 4 pillars or 4 modules to DBT: interpersonal effectiveness, which helps with making decisions, adapting to or resisting change, and meeting goals while avoiding damage. Distress tolerance helps you to learn to accept, tolerate, and learn from pain. Emotional regulation helps to decrease your vulnerability to your emotion mind. So bringing your emotion mind and your I think your rational mind together into a wise mind, and then also building the mastery of those distress tolerance and mindfulness skills that you're going to see in those 2 modules. That's all part of emotional regulation. And mindfulness skills has to do with radical acceptance and a non-judgmental stance. So just accepting each moment as it is without judgment and experiencing it for what it is without judgment as best you can. So these kinds of 4 things, and if you're interested, I have a video about DBT, a little brief video, and I am going to be going farther into these concepts. Um, DBT is the major therapy for borderline personality disorder, also for people with addictions and people with eating disorders. And it really is made to help you to recognize the feelings and emotions that you're having, the behaviors that come in conjunction with those, and how you can use mindfulness, radical acceptance, and distress tolerance to change the way that you behave towards yourself and towards others, to regulate your own emotions and to have some effectiveness in your interpersonal relationships so that you can grow and change your behaviors and have a more successful life with your relationships and your job and yourself. And so if you're interested in that, I do have another video about DBT. Here's some references for you that I used to create this small little video. But basically, I just wanted to share with anybody who's wondering a little bit about splitting and a little bit about dissociations, how they relate to borderline personality disorder, and what kinds of treatments you can look at to try to alleviate those symptoms. But really, it comes down to just being very aware of what you're doing and whether it's appropriate and what you can do to change that at any given moment. So thank you for joining me for my Borderpolar podcast, and I hope that this was informative and helpful to you. If you are interested in seeing more videos, feel free to like and subscribe. Share with anyone who you think might find this helpful, and peace and love to you, and have a wonderful day.